Hi guys. Good morning world. It is 5:55 in the morning, Wednesday, September 24th, I think. You are getting me in all my skankiness. I still got my zit cream on. I don't even care. I haven't really ever done, I've made videos before, but I've never done anything like this before, and it's totally not probably any sort of direction that anybody's going to expect from me. But I want to share my story. I want to share my story with people right now because I think it's really important. So here I go. Like I said, it is early as hell in the morning. Please forgive the 4-year-old screaming in the background. I cannot get him to be quiet. So, as some of you know, a couple weeks ago, my dear grandmother went to the hospital. This was September 3rd. Grandma had a procedure done in Iowa City. Grandma hadn't been able to eat for a couple months before this happened. She was having difficulties swallowing. She had had a hernia in her esophagus before, and she thought that it had re-ruptured. So they sent her to see a specialist in Iowa City, and they did this procedure where they go down, they scope into your esophagus, and they put a balloon in there, and they inflate the balloon to stretch your esophagus a little bit to help her get that food down better because she hadn't been eating. So it was an in and out procedure. Seemed to go good. My grandma, of course, signed one of those consent forms with all those crazy things that never happened to anybody. One of those things happened to my grandmother. The balloon perforated Grandma's esophagus. Grandma went home. She was in a little bit of pain. They probably got home at about 6 or 7. I got the phone call that they were home. And Thomas and I were just about to go to bed, and my phone rang. And my dad said, "Delaney, I just had to call the ambulance." He said, "Grandma's in a lot of pain." So I said, "Okay." He's like, "I gotta go. I gotta follow the ambulance. They won't let me ride with her." Of course, I'm in a panic. Grandma's 74 years old. So they get to the hospital in Clinton, and they did a CAT scan, gave her some pain meds. She started to feel a little bit better, but in the CAT scan, they said it was an infection. So we just thought, okay, she just got an infection, like streptococcus from the surgery, yada, yada, yada. Anyways, then the more that they look at this CAT scan, they realized that Grandma's leaking GI fluid into her lungs. So they have to life flight her to Iowa City. So Thursday morning, the 4th, Grandma landed in Iowa City, and they placed her in the ER. This is going to be my whole point right here. Advocating for somebody. So they get to the hospital, and next of kin is responsible for making these decisions when the other person is unable to. So they're giving us different options on care. At this point, she needs tubes in her lungs because they're quickly filling up with fluid, and it's making it extremely hard for my grandmother to breathe. So we opted for the tubes. It was pretty. It seemed like it was pretty painful. I actually wasn't there for this procedure, but it seemed to have scarred people. And so they put the tubes in, and everything just moves so fast when this stuff is happening. They put the tubes in, and then they say grandma's oxygen level's too low. They want to ink a tuber. I can't ever get that out. I can say extuber, but I can't get that one in. Or get that one out. Anyways, they put her on a ventilator. So she's on the ventilator. She's got the tubes in her lungs. And we've got you have two teams when this stuff is happening. You've got your doctors, the physicians, and then you've got the surgeons. And I know that some of you have probably experienced this before, but doctors and surgeons are two totally different breed of people. Doctors are a little more, they come off a little bit more optimistic, I guess, or they're a little more, what's the word? I feel like they look at the whole patient more than they do just a certain aspect like the surgeon does. So the surgeon is calling us and saying, hey, you've got two options. We can do a esophagealectomy, or we can put a feeding tube in. What's an esophagealectomy? So this doctor asks if he can go in, remove my 74-year-old grandmother's esophagus, move her stomach up, and attach it with intestines. Some of you probably aren't going to agree with me on this, but there's a point in time where you just got to let shit go. That is not something, that's just too far. So we did some research on the procedure, and the survival rate for somebody even my age and younger is low. So why offer that to a 74-year-old woman? Why are you offering something to somebody that's only 25% chance of her survival? That's just her surviving the surgery. That's not even to say getting pneumonia or, any sort of things that come with surgeries. That's not even saying that. And this is what the surgeon says. Well, I can do it. Listen, I'm not asking you if you can remove an esophagus. I want to know the survival rate from my grandmother. And this is going to be another one of my points. Western society is very disconnected to a very natural part of our lives, and that is death. Our medical system is made around keeping them alive at all costs. And not everybody, I mean, we're not all the same. And I know some people, we always want quality over quantity. But we also are going to trust our professionals when we go in there. And when they're offering us stuff, I had to look up the survival rate of this surgery on my own. That wasn't being said to me. If advocates for these people go in there and they don't know what kinds of questions to ask, they're going to just trust what's happening. We don't always know our rights. And then we get in these situations where we're like, okay, so we can do this. This is going to help them. We'll do the esophagealectomy. And then what happens? These elderly or these people end up on breathing machines. Their quality of life is crap. We keep them on, we don't even save their life. We prolong their death, and we have labeled death as being medical. That's what it is. If we think about it, death to us is medical. It's not. And we don't even deal with it. We don't even deal with it anymore. Families don't take care of their dying loved ones. You don't see it very much anymore. So when you're in those situations too, we have no idea what we're doing because we don't see it. We send our loved ones to hospice or to nursing homes. And everybody there works their asses off, so please don't get me wrong when I say this, but our medical and healthcare system does not know how to take care of our dying. They don't. They're not getting taken care of like they need to. And I will get to my point on that in just a minute. So they're not taking care of us like they need to. So I'm going to continue my grandma story. So grandma is in ICU. She's got the tube in, the ventilator in, the tubes in her lungs, feeding tube down her nose, and they want to put a stent in to cover the perforation. So let's go back. This is the surgeon. Let's go back. The surgeon said we had two options: feeding tube, esophagealectomy. Also keep in mind this is a for-profit hospital. And when we opt out of the radical surgery and they put the feeding tube in, the next day they offer a stent. A stent. They just went in there and put a stent in her esophagus. Why? Where was that before? So we put the stent in. Grandma, and they biopsied her esophagus. Saturday morning, we get a phone call. Grandma has stage 2 esophageal cancer. We weren't completely shocked on that. So this is Saturday. So Sunday morning, Grandma gets her breathing tube out. Huge weight lifted off her shoulders. So when she got that out, Grandma got moved into the general hospital. And Grandma had an 8. This is Sunday night she got moved into the general hospital. And Grandma had an 8 since, well, barely anything at all for months. But she hadn't even had an insurer or anything since Tuesday because she also had a fast for her procedure that was on Wednesday. So Grandma had an 8 in days. So she gets down to general hospital and they have a, what was that specialist's name? Nutritionist come in. Anyways, they approved her for a soft food diet. This was the first time Grandma really got to swallow anything that wasn't an Ensure shake or Gatorade in months. And so that was really great. That was an emotional moment to see that. So this was that Sunday? Yes. No. Yep. Monday she got the food. So Grandma spent the week in the general hospital and she seemed to be going uphill. They were able to take the catheter out. She was walking herself to the bathroom. By Wednesday, they upped her to a soft diet instead of liquid diet so she could have mac and cheese, mashed potatoes. She was still taking it kind of easy. She was pretty nauseous, a 74-year-old on fentanyl and tons of antibiotics is a lot, and just everything probably. So Friday morning, the hospital calls me and they tell me that Grandma has been approved to go to skilled care. Grandma and I had made the decision that Grandma was going to come live with me when we found out she had cancer so that I could help take care of her and she could go to the Mercy Cancer Clinic here in Des Moines. Anyways, so they transferred Grandma from Iowa City to Bishop Drum down here in Johnston. And I'm going to drop names. And if this gets out there, my bad. So she goes to Bishop Drum down the street from me. And she was only there for a few days. She seemed to be doing pretty good until last Wednesday night. I called Grandma. I was supposed to come see her at her window because they won't let us have visitors there like they did in Iowa City. Grandma answered the phone and she wasn't breathing very good. And I said, Grandma, what are you doing? Grandma goes, I'm dying. I didn't know how to take that. She said, I'm in a lot of pain. I can't talk. I'll call you if I feel better. She hung up on me. that's not grandma. So I was freaking out. I called the nurses and I said, hey, look, I just got off the phone with grandma. She says she's in a lot of pain. The nurse said, yeah, I was just in there. I gave her some Tylenol. And I'm just trying to trust my professionals because I know we are all always doing our best at all times. I'm really not trying to trash any professionals, nurses, everybody does a really, really good job. I'm just talking about the system in general and the way that we run it. Don't get me wrong. Medicine's good. Nurses, you're great. I am so grateful for the nurses and all the doctors that are taking care of my grandma. So please don't get me wrong. I'm just talking about our system in general. So grandma, the nurse, I'm just trusting the nurse. My gut's telling me that grandma needs to go to the hospital. And I should have listened to my gut, but I have to let that go. Anyways, I let it go and I went to bed and I called the nurses at 8:30 in the morning and I asked them if they had been in to see my grandma yet. And actually, this one I'm a little pissed off about, but this isn't nurses in general. It's just that staff. I called the nurses. It's 8:30 in the morning, and I asked them if they had been in to see my grandma yet. They said, no, we haven't done rounds. I don't know a lot about running a nursing home, but if you haven't seen my grandma yet and it's 8:30 in the morning and you know she's in a lot of pain, I am a little concerned. So I call grandma. Grandma's having trouble breathing still. She's in a lot of pain, and she's pretty sure she had a fever. I asked her how long she's been up. She says, Delaney, I have been sitting here since 6 in the morning in a wet bed. My grandma had been sitting in a wet bed for over an hour and a half. So to say I was livid isn't enough. I was pissed. So I called the social worker and I said something. I was mad. And I also want to say that I know that things are really hard at nursing homes right now. They're short-staffed because of COVID, and it was already hard to touch base and get everything you needed to do beforehand. But I was pissed. That's my grandma. So then I called the nurse back again and I say, hey, my grandma's bed's wet. And I asked her why she thinks my grandma's side hurts. None of that matters. Anyways, the doctor finally comes in at about 10 in the morning and checks grandma out. He is worried about sepsis. They call me and tell me that they are transporting grandma to Mercy Hospital in a ambulance. And we get there and grandma's left lung had so much fluid in it you couldn't even see it in the ultrasound. In the ultrasound. So it's just me there. I'm advocate this time, and they're asking me questions, having me fill out paperwork, and I wasn't quite as prepared as I would have liked to been. Liked to have been. Whatever. I am so exhausted, you guys. Anyways, long story short, grandma is back in Mercy Hospital in the ICU. She has been on the ventilator for 7 days now. They had to put her on the ventilator so that they could drain her lungs. And when the left lung, this time though, it was just that side. But this time when they put those tubes in, it wasn't just a little fluid. The second that tube hit my grandma's lung, a liter of fluid came out of her lung. It's just filled with a strep. She's got strep in her lungs, which is the same infection she had in Iowa City. So I'm in the ER. Actually, I do want to go back. So when I'm in the ER and they take that fluid out, naturally the surgeon team comes in. And this lady comes up to me and she is just talking to me a little bit and talking to me about my options. And she again brings up either we can wait and take a look at her esophagus and see if it's leaking, or we can go ahead and we can try the esophagealectomy. And I looked at her and I told her, I was like, look, I want quality versus quantity. So it's not about it's not about the length of time that I get to spend with my grandma, because I don't want, anyways, it's not the length of time, it's the quality of her life that is important. And she just looked at me, she just looked at me and she goes, okay, so what, like, she's like, okay, so those are, so just basically like, so what do you want to do? And I said, well, which one's going to give me quality and which one's going to give me quantity? And she just kind of looked at me and I was like, look, you're the professional, so I know that you know what decision I make will give my grandma quality of life and which one will give her quantity. She said that she was better off surviving the esophagealectomy back in Iowa City. And I said, okay, then let's not bring it up again. Again, they bring up the surgery, and there's a bunch of students around me. Anyways, again, they bring up the surgery. So I had to leave. They took grandma up to the ICU, and I get a phone call from that surgeon again later that night. And the surgeon's telling me that if grandma's esophagus is leaking, there's really no surviving that. So our option is, guess what she brings up again? The esophagealectomy. And I was pissed. I was like, can you please tell me? I was like, so you're saying she's not going to live if I don't do it, but what's her survival rate at this point if I give her the esophagealectomy? And I kid you not, this lady said 0%. She straight up told me that the survival rate of my grandma getting that surgery is 0%. And she still said it to me. I am sorry, but at that point, you aren't trying to save anybody. You're using my grandma as practice and morbid play. And that's what they do. So since this happened on Wednesday, I have been researching my ass off. I have been listening to audiobooks, all this stuff, and I'm learning a lot about being an advocate and things that are wrong in our society. And I just want to talk about how important it is, you guys, because we are all going to be in this boat at some point in time where you have to advocate for somebody that you love, and we need to go in there knowing what we're getting into, knowing our rights. Go in there and you need to know your rights. Like, I didn't know that we could appeal my grandma leaving that hospital in Iowa City so early, and I wouldn't have let her do it. It seemed really fast to me, and it was fast. She didn't even get rid of the infection. She was off the antibiotics for just a couple of days, and it imploded in her body. And now today at 1 o'clock, I am meeting with palliative care. I don't know if you guys know what palliative care is, but palliative care is pretty much palliative care comes in when we're at a lull. So grandma's just kind of sitting here. We're on 7 days on the ventilator, and we're not moving. So it's not like we're going down, but we're not going up. So we don't know which way we're going. And so the family's constantly, at least I'm assuming, we're oscillating from, anticipative grief and hope, just constantly. And that's hard. But they bring you in. I always say it one time and then I can't say it again. Palliative care at 1 today. So what we're going to do with palliative care is we're going to talk about both directions. What our choices are, what our plan is, all this kind of stuff. And then we will also talk about if it goes downhill. Today I will be advocating my grandma's, sorry, this is hard. end of life plan. And part of this journey since Grandma was in Iowa City is I've been doing research anyways, and I want to do this for her, and I actually am pretty convinced that I want to do this as a career. Only it would be called a death doula. So I've been up all night researching, and I want to tell you guys that if you just, when you are in these situations, please read and empower yourself and go in there knowing everything you can possibly know, because I'm already going in there with just different things. Like, they're like, oh, we don't know why we can't get her off the ventilator. I found out right away that reasons that they can't get people off the ventilators are metabolic and endocrine problems. She has a hypothyroidism. Another thing, body composition alterations. She has lost so much weight. Depression and anxiety. Well, they keep giving her more sedation because she's anxious. And then heavy sedatives make it hard for them to get off the ventilators. So, like, where is psychosocial therapies? Why don't we get her moving around, get her on her meds? Can we find a way for her to talk to us? Because she thrived in Iowa City when we could see her. And that's another problem with this COVID thing right now. Like, people are really having a hard time, and it's affecting the way that they are recovering. But yes, just back to this. We really need to empower ourselves when we're in these situations. And again, the way that we handle death in this country is just crazy. Like, when they're offering me these surgeries and stuff, and like me saying that I'm bringing my grandma here, I had some people ask me, when I told them this, I really had people ask me, why? To me, death is a heart-centered, home-centered, family-centered, and very, very personal thing. And we throw them in the hospital when they're first sick, and then they get thrown in hospice or nursing homes, and they're left on beds with their butts out, and we've got things down our throats and all this stuff, and we lose our dignity. We die without dignity, and we don't even think anything of it anymore. We don't really see death. I am right now on the journey in my life where I am fully embracing it, and I want to make a life career out of it, because I think it's really important, and people really need to feel empowered in these situations, because it's tough, and we really need to do what's best for our family, and we need to get our loved ones back in the homes with us, and we need to get back to what death really is, which it's a beautiful part of life. Obviously, medicine is involved, but it's not medical. It's not medical at all, and medicine is obviously going to be involved if the person is not well or we need pain management, but that's not what it like is. Anyways, I just wanted to hop on and just share my story with everybody. Please, if you guys are going through this, or if you've been through this, I now understand, or just some advice, please research everything that's coming at you. Research what they're on, research what they're going through, research your rights. I've been listening to this book. It's called Die Well, and it's a doctor who has seen a lot of this kind of stuff, and he's talking about how he would have patients come in from nursing homes that could barely move with Alzheimer's and stuff like that. It was an 82-year-old man, and he looked at his chart, and he had pneumonia, or he had a cold. He thought that they were there for that, but he looked at his chart, and he was getting a full hip replacement. He was like 92, and the doctor that's reading the book, obviously, he was like, seriously, they do this to test on the patients. Okay, I get it. You gotta learn how to do stuff, but it's just, we gotta fix shit, guys, and embrace death. Like, such a freak about it now. It used to scare the crap out of me, but now I'm a total death advocate. Let's normalize dying with dignity. Let's not keep people alive with poor quality of life. It's pointless. We've got to let them go. We need to stand up for them. We need to make sure that once we write their end of life plan, their advance directive, that they're in places where they can guarantee us that they are going to respect and their wishes are going to be safe. Make sure you're asking your doctors where those places are. That is so important, because if you're not there to advocate for them and it's an emergency, they will act without calling you. That's another story. A pacemaker and an 82-year-old woman who was having some sort of heart problem in the emergency room, and they put a pacemaker in her, even though she had an advance directive that said that she didn't want anything like that. Our system is broken, and we need to be able to know what kind of questions to ask, know that we have choices, and even if we know that we have choices, know that you can speak up. If everything is going too fast for you, we've got to think, well, we just got to be present. That is the best thing that we can do, is just to stop and be present. We got to be present. Anyways, pro-death, guys. I had to share my story. Thanks for listening. I'm very tired. I've been reading more now than I ever have in my life. Please send love our way. We are about to go on a very uncomfortable, actually I shouldn't even say that. It could go positive. I'm trying to be ready for both things, but even if it does go positive, it's going to go the other direction. But I'm about to go on a very beautiful and uncomfortable journey with my grandmother, and I'm not sure how long it's going to be. I hope we have time left, but whatever it is, like I'm going to tell her today, Grandma, I respect your path, I honor your journey, and I support any decisions that you make today. I am not here to make any decisions for you. I'm here to advocate for you. She can't talk, but she can write on the marker board, so we're going to do our best. I want her to make her own decisions, and I will just make sure that I have all the knowledge that I need to back that up, and I'm feeling pretty confident about that. All right, guys. I love you. I love everybody. Have a good day.